All right. Good afternoon, everyone. We'll get started. Today we'll hear from Mayor Tom Barrett. Next, we'll hear from Dr. Ben Weston, Director of Medical Services for the Office of Emergency Management. We're also joined by Dr. Jeanette Kowalik, Commissioner of the City of Milwaukee Health Department, and Dr. John Fagman, the Infectious Disease Specialist for Froedtert and the Medical College of Wisconsin. Thank you all for being here, and Mayor Barrett, we'll start with you.
Well, thank you very much, Catherine. Good afternoon. It's Tuesday of the 4th of July week, and as we start preparing for the weekend, I'm very, very mindful of the fact that as we look around the map of the United States, that we are seeing an increasing number of cases of COVID-19, particularly in the South and the West. And I know Dr. Weston has obviously tracked this incredibly closely. And I would like to think that for some reason we're immune to this, but I don't think that that's realistic to think that we are going to escape the increase of cases. And so what we have to do is be very, very smart about this and try to continue to do what we have done in terms of social distancing and taking those protective steps that are necessary. To that end, we have continued to work with the health department along with the city attorney's office as we examine the appropriate way to go forward with a masking policy, in particular for restaurants, retail establishments, and places where you cannot socially distance at the 6-foot area. So one of the concerns we have, of course, is making sure that whatever we do is going to meet the legal requirements for putting forth such an ordinance, which is the route that we're looking at right now. Racine had done it through its health commissioner. That was challenged. The Common Council in Racine then, in essence, passed a resolution that delegated the authority to the health commissioner there. That was challenged as well. And at least at this point, it looks as though we are going to have to take more definitive steps. The whole purpose for doing this, of course, is to protect people. And when you think about the fact that 125,000 people in this country have already passed away because of COVID-19, every one of those people who died caught it from somebody else. Every single one of them caught it from somebody else by definition. And so when we talk about these protective steps, it's not as a punishment, it's not as a political statement, it's as a public health measure to make sure that you as an individual do not get sick, and equally important, that you as an individual do not spread the disease. I don't think there's anybody who intentionally is spreading the disease, and that doesn't bring back all those people who've died or all the people who've gotten sick. So what we're doing at the city is we're continuing to work on the webinars. The successful webinars that we had last week have been, I think, a template for us. Tomorrow we're going to be working with Safe and Sound and other groups to have one that talks about summer activities for kids and what we can do there. And that will be, again, you can go to our website if you want to sign up for that one. That's for outdoor activities, youth activities over the summer. And then Thursday we'll be doing one with contractors, people doing work around houses. And we'll have representatives from the Housing Authority, from city departments to talk about the special care you can take in those situations as well. So again, you can go to the City of Milwaukee Health Department and they'll steer you toward those webinars, and those have been successful. But as we head into the weekend, again, every single one of us wants to forget the fact that we've had this pandemic for the last 3 months. But that's the worst thing we could do, because we know, again, just listening to Dr. Fauci today and his concerns that we might see even greater numbers of cases because people have gotten so lackadaisical, makes it even more important that we continue to let people know how important it is to take safety steps. A couple of other points that I want to make. One having to do with the National Guard. As we've said previously, the National Guard will not be testing July 2nd through the 5th. And that is because these individuals have been working very, very, very long hours over the last few months, and they're going to have other things they need to do around the 4th of July in terms of their professional activities, but also to give them a little personal time for their families. Many other testing sites probably will be down for the 4th of July, but if you feel a need to be tested, and again, particularly if you're someone who's been involved in one of the protests, if you've been outside a lot with other people, if you've been in contact with other people, please call 211 and get tested. It's very, very, very important that we continue the aggressive testing. The numbers have gone down, but when I say the numbers of people tested has gone down. We've seen an increase, and Dr. Weston can talk about where we are in terms of the positivity rate. But it is still very, very important for us to have people tested. So with that, I'll turn it back to you, Catherine.
Thank you so much, Mayor Barrett. Now we'll hear from Dr. Ben Weston.
Thank you. Good afternoon. First to our numbers, we have 11,397 confirmed cases of COVID-19 in our community and 355 individuals who have died. We're certainly seeing beautiful days, hot weather, and aside from being inside your own home, outdoors is luckily a pretty safe place to be with regard to the COVID-19 pandemic. The open air, the breeze makes person-to-person transmission of the virus more challenging. That said, you can still get infected with COVID-19 outside, and it's still important to remember to take precautions. So just as with any situation, you can think about 3 items we've talked about before: people, space, and time. So minimizing the number of people with whom you closely interact, ideally only those with whom you live in your house, but without question avoiding any large crowds, maximizing the space between those around you. And so for example, going to a beach or going to a park that is not very crowded might be fine, but certainly separating yourself from others by a minimum of 6 feet, and wearing your mask for added protection when out in public. And if you do have to pass by others on a path or on a sidewalk, keep your distance, but also minimize that time factor. So passing someone on a bike path is relatively low risk, while sitting with someone inside a restaurant is going to be much higher risk. Each of these precautions, as the mayor mentioned, are as important now as ever. We're seeing throughout the country states, frankly, going in the wrong direction in their positivity rates of COVID-19, and we see hospitals nearing capacity across the country. As we see much of the country, and indeed much of our state, seeing a higher burden of disease, there's no risk to think that Milwaukee County will not be affected, and that we won't start to see our numbers move in the wrong direction as well. That's why we must stay vigilant. So consider, again, people, space, and time. Wear your mask in public. There's no doubt that wearing a mask is less comfortable than not wearing a mask, and certainly warmer than not. But it remains a critical way to minimize the spread of COVID-19. I see a lot of people wearing their mask low, only covering their mouth and not their nose. This is not effective. I also see people wearing their mask lowered around their necks. This is clearly not effective. So wear a mask that fits snugly around your nose and your mouth. So please enjoy the weather, enjoy the outdoors, but wear your mask. And remember people, space, and times, and remain cautious. Thank you and stay safe. And I will pass it along to Commissioner Kowalik.
Good afternoon. Thanks, Dr. Weston. As Mayor Barrett noted, where we're at right now and looking at the city of Milwaukee, Milwaukee County, the rest of the state, the rest of the country, various regions where there is some loss of gains that we've made in our COVID-19 response. So we're monitoring this closely in our local area, and we know that that public-facing dashboard that the county has, as well as the city, ours is updated now weekly, where you're able to see how things are looking. If you look at the cases by day, if you check every day, you'll see like a variance. So you'll see kind of a peak, and then you'll see kind of it flattening. A lot of that has to do with how the data is being processed. The positive cases are normally processed first. So if you see like the positivity rate, it will be very high. But then as the negatives are entered, then that brings that positivity rate down, which is why it's better to look at a week versus looking at daily numbers. So we go with this 7-day average as far as looking at the progress that we're making in our community here. We also know that our gating criteria also had various checkpoints. So we were looking at where we were at, right? Like we went into phase 3, and then we had one red for one of our indicators at the beginning of the week. And we determined that because we had the one red, that meant that we couldn't look at moving forward at that point in time, that 2-week interval. So we added an additional week, and that was last Friday. So when we reviewed the data last Friday, we were looking stable. Remember, the gating criteria looks at being stable. If you're in yellows and greens, that you are clear to move into the next phase, which is what we did for phase 4, which takes effect at 12:01 a.m. Tomorrow, 1st of July. We are continuing to monitor and watch what's happening, because last thing we want to do is kind of dial things back. We also know that there's been a lot of feedback and people are paying attention to what's happening. Since we have orders in the city of Milwaukee, it's our obligation to educate our community about what these mean. And we've been very gracious about how we are going about our orders. We haven't been heavy-handed on folks. We haven't been, the mask police or anything like that. We've been very gracious. But at this point in time, because we're looking at what's happening, the trends that are happening in other parts of the state and the country, we're going to have to be more aggressive with our enforcement. So I just wanted to make sure everyone understands what this means. So as a capacity still is capped for the gathering, the lesser of the three, the 250, 50% now of building occupancy, or 1 per 30 square feet. So depending on the situation, that might not change your circumstances for your business. But if it does alter it a little bit, we are going to be checking capacity. So the health department will be monitoring this capacity. Remember, we have an order, it's not guidance. So it is something that we can enforce. Normally what we do is when we see a violation, there's a discussion, there's an education opportunity. And then if we see a repeat violation, then we move into some actual citations and things like that. We have received, and I said this before, we have technology now, so people will send us pictures, videos, various accounts, screenshots of social media, and all of that stuff. So we do evaluate that. We do consider that to be evidence, and then we do move forward on that account. So just again, highlighting, when you see violations of the order, please let us know so we can act on that. We're going to make sure that health department staff are more visible and out in the evening and over the weekend where we see some of the violations, or we have been told of some of the violations. But that email address is the CEHadmin, so ADMIN @milwaukee.gov. It's the same email address we've been promoting along the way. We also want to just highlight again the personal responsibility in helping to prevent the spread of COVID-19. And I know that there's a lot of energy around masks. As a public health professional and as someone that's high risk, I'm all about masks. So we just want to, again, remind people that wearing a mask, we were like, it's for you if you happen to have the virus, to keep it from spreading to other people. But I want to twist that. I want us to look at the indirect way. So if everybody wears a mask, or more people can wear masks, the people that can wear masks, that you are reducing your chance of being exposed to COVID-19, the more people that do it. So it's somewhat like with vaccination and herd immunity. You get more people doing it. There's a small amount of people that can't do it for medical reasons or whatever, but they're protected by having this groundswell of support. So I just wanted to again show the proper way to wear a mask, because as Dr. Weston noted, some people are, riding low. It's kind of like sagging your pants, or they're wearing it around their neck. And if there's viral material, you could be possibly giving it to yourself by touching the mask and raising it up and down. But this is my mask for today. It pretty much describes how I feel on most occasions. But you put it over your ears, and you don't touch the middle part, and then you fix your glasses or whatever. So this is a cloth mask. You can wash it, you can reuse it. We know that there's a number of initiatives that are handing out paper masks, and the material, the Mask Up MKE material. We want to make sure that there's access to more washable masks in the market, so the health department is working on that. And we will be circulating some health department branded masks in the near future. But again, it's just getting everybody out to understand our role and our obligation as Milwaukeeans to try to prevent COVID-19 infection in our community. And it's not just the business owners, it's not just government or healthcare institutions or first responders. If everyone takes a part of this and eliminates what the mayor was saying about how wearing a mask could be like a political thing, or at least some people are seeing it as such, which is the wrong way to go. We want to make sure we know that we can do something to help prevent the spread. So why are we not doing it? Political affiliations aside. So I just wanted to, again, just highlight the importance of wearing a mask and the hygiene piece, washing your hands, using hand sanitizer, because I know many of you are out and about. Also, cleaning high-touch surfaces on a regular basis. You'd be surprised how frequently those things can build up. So you want to make sure that your doors, doorknobs, handles, things like that are being sterilized on a regular basis. And then, of course, just monitoring if you do start feeling under the weather. I know some people are very sensitive to allergies and things like that. It's best to just get tested. If you're an essential worker, you're more likely at risk for being exposed, so you should get tested on a regular basis. If you are participating in First Amendment activities, you should get tested on a regular basis. And then also, if you have people in your family that are high risk or over the age of 65, please consider getting tested for peace of mind that you're not exposing them to COVID-19 by being out and about and then bringing it back into the house. So the testing aspect is really important. Again, getting tested is not just a one-shot deal. You should get tested on a regular basis depending on your level of risk. And then again, as the health department, we want to just continue to promote safety during the season. We know it's warm outside and everyone wants to be out and about. But just over the weekend, looking at the beach and just being horrified with how much gathering and closeness there was, of course, minimal mask wearing, that we need to make sure that we are doing this in a safe way and that we're not going to be like the rest of the country or other parts of the state that are losing all of the gains, all of that staying at home, all of that stay at home save lives, and then us having to go back to the drawing board and move forward. So let's just do this the right way. Again, phase 4 order takes effect tonight. Very modest changes with this one. We still, again, have that, the lesser of the three, the 250, now 50% or 1 per 30 square feet. The youth summer camps or groups and child cares were 50%. That will go up to 75%. You may ask why. We do know that many people are required to go back to work, or they're being phased back into work. So we want to make sure we're providing some protection there, but working with our partners at the state, making sure child cares are on point with their sanitation and disinfecting, and that they're not allowing kids to come in that are a little under the weather. You know how it is. I'm a mom, so I remember how quickly an outbreak would happen at the child care center. So again, that's some of the major changes in phase 4, but for the most part, everything is pretty much stable. And then we'll be revisiting phase 5 and just what that looks like moving forward, because the way that the gating criteria is set up now, again, when you're stable, you're able to move into the next one, and we need to be more cautious. So we'll be revisiting that. So we just wanted to prime you all to know that there's some changes coming and that we're continuing to evaluate what's happening in other areas to make best practice or considerations for the city of Milwaukee and Milwaukee County at large. Thank you.
Thank you, Commissioner Kowalik, for the demonstration as well as the important context and clarity. So we appreciate it. Momentarily, we'll hear from our final guest. And just a reminder to media, if you would like to ask a question of our guests, please let me know. Otherwise, feel free to put a question in the chat box. And lastly, we'll hear from our guest, Dr. John Fagman. Thank you so much for joining us.
Thank you. First of all, I just want to thank Dr. Weston, Commissioner Kowalik, and Mayor Barrett for their really thoughtful. I'm an infectious disease doctor. I can attest that their messages is spot on. You know, there's a temptation to minimize risk and to relax, and this is not a moment to do that. So I really appreciate the hand hygiene reminder, the masking reminder, and then Dr. Weston's concept of people, space, and time. I think that's spot on. People like me are the people you'll meet if you end up in the hospital and having to deal with COVID. I also want to say thank you to the city and the state health departments, as well as the National Guard testing sites, because they've done a terrific job really ramping up testing in a way that's, I think, affected our ability to effectively manage the epidemic locally. And I also wanted to say that, you know, as the National Guard sites step away, that there's a lot of capacity that we've developed in the health systems to do testing. And we really need to get the message out there that the health systems, the adult health systems, children's, and importantly, the federally qualified health centers and safety net clinics all have much greater capacity to do COVID-19 testing now moving forward. So we stand ready to test, you know, anybody that really needs to be tested. I would remind you that, you know, you don't have to wait until you're really sick to get tested. The symptoms can be very mild in some patients, and it's important to know your status. One thing that's really important, I do HIV care as well, is anytime you know your status, you behave differently. And so knowing that you are or are not infected, knowing that that little bit of a sniffle is allergies versus COVID-19 will be really, really important moving forward. So the symptoms, not just waiting until somebody has high fevers, severe shortness of breath, cough, but remember also those more subtle symptoms of loss of taste and smell. And then, and some diarrhea, sore throat, muscle ache, fatigue, some of these things. We all are really ready in the health systems and the safety net clinics to provide testing. So just encourage those listening to convey the message that the health systems, all of them, have capacity. They all have ways on their websites to direct you to get an appointment, come in, get tested. If in doubt, get tested, because that will be key to understanding how we manage the epidemic moving forward.
Thank you, Dr. Pengman. We do have several questions. Our first one is from Sharon Bajenda with CBS 58, and it's for Mayor Barrett and Commissioner Kowalik. She asks if we're moving into phase 4, or are we still moving into phase 4 tomorrow with all that's happening around the country, and why do you believe it's still the right choice for Milwaukee?
Commissioner, I'll let you start out.
Yeah, so that was a very tough decision. Again, we are looking at our data, our local data. Of course, you're mindful of what's happening in other communities. You're also looking at the variance, not looking at 1 day or even 2 days, but you're looking at a week. Where are we at right now? So we had already postponed moving into phase 4 because we had a red earlier on in that first 2-week period. So having that additional week where we're assessing the data and we're like, okay, it's looking like we're stable. Remember, again, the gating criteria stated if we had any yellow or green that we were stable, we could move into the next phase. So that was the decision point for us, feeling that it would be okay for us to move into this level. Knowing that phase 4 doesn't mean that we're gangbusters and everything is just open, like Texas or some of these other areas that just threw anything out of the window. We're not doing that here. If anything, we're also being mindful of what the future looks like, and we don't want to like ease into things too quickly. You know, we have this 2-week period of maintaining yellows or greens, and then you can move into the next one. I mean, we'll be at the end of the line, and that's too soon. So we are reevaluating that. Also, that we, as the mayor noted, these webinars and educational opportunities per sector is very, very important, because you can't just provide a canned message for all businesses and sectors and think that that's going to do the job. You have to make sure that the prevention messaging is specific to every sector. So, you know, I commend the mayor and mayor's office, health department staff, MCW for coming together to put these webinars together. And there'll be many more. You can also watch them again on our website, milwaukee.gov/MMFS, Moving Milwaukee Forward Safely. So you can see what has been provided. But the enrollment has been tremendous. People are taking a part of it. They're sharing information. And, you know, we really want to educate the sectors about what they need to do to prevent the spread in their areas.
Let me, if I may, let me just expand on that and compliment the health commissioner. Going back to March, one of the things that I said from early on was that we would, as a city, follow the science, that we will look at the criteria that has been set forth by the CDC, by the state, and by the health department, and make those decisions as to how quickly and how we would reopen the city based on the science. And I did that because I'm very mindful of the fact that there are a lot of strong opinions about the speed with which we should reopen, how we should reopen, and that there are political considerations that people have on this. I really did think it was, and I still think it's important to try as much as possible to keep all the politics out of this and to follow the science. And so when the commissioner said, this is where we are moving to phase 3, it was based on our reading of the parameters to move to phase 3. Moving to phase 4, our local data, as she said, supports that. Now, having said that, as I've indicated and others have indicated on this phone call, we are all looking at the national scene as well. And it would be foolish for us to ignore what's going on in Texas and California, Arizona, Florida, other states. And so we are looking at very, very closely. And that's one of the reasons that we're talking much more and are going to be taking actions pertaining to masks, because we think that that's an important next step, particularly as people are out and about in the public more often.
Mayor Barrett, actually, you just kind of started answering Sharon's second question. She has a few for us. The second one is, if we were to mandate masks, when would that decision be made, and why do you think that's an important ordinance?
Again, looking at what has happened around the state in particular, looking at what's happened around the nation, we know that there have been places here in Wisconsin, Racine in particular, that did it first through its health commissioner. And we've had this conversation, the commissioner and I have had this conversation with our city attorney, that when that was done through the health commissioner, there was a challenge to it. And based on the Wisconsin Supreme Court case that occurred several months ago, that decision was in essence overturned based on the fact that it was done by a health commissioner and not by an elected body. What happened next in Racine, as I understand it, and I've heard different accounts, but as I understand it, is the Common Council then passed a directive giving the health commissioner that authority, and the judge still rejected that. I don't know if that's on appeal, I don't know where it is, but we thought, we're not looking to have an extended court battle. We're trying to figure out how can we deal with the issue at hand. And the issue at hand is, as more people are interfacing in bars, in restaurants, in retail locations, what can we do to help the health of those individuals, and more specifically, the health of individuals they come in contact with. Obviously, if someone doesn't care about themselves, there's nothing we can do about it. But they certainly, even if they don't care about themselves, they can be spreading this. And I think that's where we have the authority as a city and where the health department has authority. But we have made a decision that we're going to do it through our normal legislative processes, which means there will be a hearing this Thursday before the Public Safety and Health Committee of the Common Council, where the chairwoman, Marina Dimitrievich, is working with us to fashion a policy that would go through the Common Council, which is going to be meeting next Tuesday. So that's sort of a timetable as to where we are as a city.
Okay, thank you. Sharon still has two other questions for any of our three health professionals on the line. She asks, do you believe there's a lack of mask wearing? And why is the 18 to 39-year-old group still the majority of positive cases in the county?
I'll take a first stab at it. I think that it's helpful when you're in a public place and it's hard to socially distance to wear a mask. I think that's when it's very helpful. When I drive around, when I walk around, I see plenty of people not doing that. So to the question of whether there could be more mask wearing, I would say absolutely. As to the demographics that we're seeing younger people doing it, I'll say what my thoughts are and what some of the research has shown. I'd be curious what other health-oriented folks on this phone call think, but certainly we see less, more of a return to normal from the younger populations. And so when we look at restaurants, when we look at bars, when we look at beaches, we're seeing more young people. I think our older populations, especially knowing that they're more susceptible to the detrimental effects of COVID-19, are probably inherently more cautious. That said, of course, even though young people are less likely to get sick, we know the youngest person in Milwaukee County who's died was in their 20s. And there have been people far younger throughout the country that have died and that have gotten very sick, certainly. And even so, even if the symptoms are typically more mild, it still is very much possible to spread it to others around you, whether it's your parents, your loved ones, your neighbors, your friends. So we're certainly seeing an increase in younger age groups, but it still is a concerning increase.
I might just say that the desire to go back to normal is a totally normal desire. We all would like to go back to normal. I'd like to have a very normal, what my life was like at the hospital before this happened. And so I'm very sympathetic to that. Wearing a mask is a behavior that takes a while to get used to. It's hard for me. I'm not a surgeon, but getting used to walking around the hospital, breathing through a mask, it's not straightforward and intuitive. And then we've been, unfortunately, living in a world where this has become, as Commissioner Kowalik and Mayor Barrett has said, politicized, and that's one of the real tragedies. That we're adapting to a highly dynamic epidemic, and it's going to be something that changes. Our approaches to this will change over time, and the messaging is really, really important. That's why I've been very appreciative of what I've heard from our public health and city officials on this call, because it's spot on.
Thanks, Dr. Feynman. My other point too is how he noted that this is dynamic. So that even the outreach has been extremely dynamic. The messaging has changed. Depending on the source, there's a variety of messages. Some of the messages are old and people are clinging to some of the older messaging versus where we're at today on the 30th of June. So we know that that can be very confusing for the public. And I always say that people are paying attention, because if you look and see where these groups are, where we're like, oh, there's a spike here, there's an outbreak here, then you see other groups that are like, oh, I don't have to worry about that because that's where the disease is now, and a lax or a feeling maybe that they're not susceptible to COVID-19 infection. So there needs to be some very pointed messaging for younger people, adolescents and young adults. And a lot of this, when you're looking at public health promotion theories and models, is you have to look at where people are at and you alter the messaging based off of where they're at. So there needs to be some market research, some ways to hear from young people, like what matters to them, and then adjust the messaging based off of that. So that needs to happen. We do have some funding mechanisms in place to where we're gathering information, but as you can imagine, when you're making an outreach campaign or a movement, it takes time to put those things together. Where we're at right now, by the time something's developed, we might see a spike in another group, but we still have to do it because that's our obligation as public health professionals. So it's very stressful because we know time is of the essence. We want to get the marketing out, get the messaging out. We do know that the mask wearing has been pretty consistent once the CDC had announced it. And Dr. Fauci even noted that too. Like, the reason why they didn't say that early on is because they wanted to make sure that healthcare workers and first responders had access to masks, that people weren't, flooding and buying bulk and just keeping their stockpiles and taking away from those that were most at risk. Now that there's more masks on the market, we're perfectly fine with saying, get a mask, or you can use various homemade features. If you're crafty, you can make your own, sew your own, whatever. But just having that cloth over your nose and your mouth provides some protection. So just getting that message out to young people that, this is what we have to do. This is our wave. Think of it as a new accessory, and figuring out ways to activate peer leaders to make it cool or normalize it, because you know how that goes with younger people. If you're the outlier, you're doing something different, you have to be very courageous and take a risk because of peer pressure. So, just acknowledging some of the backstory here from a public health professional's perspective of what we're trying to do and how we're trying to raise time here.
I do love an excuse for a new accessory.
Yes.
Sharon's last question is also similar to Allison Durr with Milwaukee Journal Sentinel's question, so I'm going to blend these two. And if I don't fully answer or ask either of your questions, please let me know. But Sharon notes that Dr. Fauci says that the country may see 100,000 new cases in a day if people are not careful. So why did the city decide to move into phase 4, even if the country is looking at a surge in cases? And what is the likelihood that the city would revert to closing businesses again?
So I can kick this off, and I don't know if the mayor and Dr. Weston wants to add to it. Again, we're using our gating, our criteria. There was a lot of collaboration and insight into creating that process. So that's what we were sticking with. When a lot of these other updates, like Dr. Fauci, I know there was something Friday, and then recently, we're looking at where we're at over the last week, right? There's always a lag in reporting. We do know that. But we use the data that we have for our individual community to make a decision. So, if we made a decision based off of what's happening in New York City or what's happening in Florida, what's happening in Arizona, how does that show what we're doing locally, that we have orders, that we have various precautions in place? How is that showing that it's working or not? Because we're looking at what's happening outside. So that's a very fair question to ask. I mean, I've answered that question as far as a number of my colleagues and peers wanting to know more about that. Of course, we also are mindful too, when we say we're going to move forward, that this is taking effect at 12/01. And you saw what happened with the governor of New Jersey. They're, in a situation, they're like, okay, well, we're going to pull ours back. And dining is suspended indefinitely, dining in. And basically that happened yesterday. They were planning on opening on Thursday. You have all of these operators that have purchased, all of this food. They've hired all of these staff back, got everything to go. And then 2 days before, 3 days before, you're saying we're not going to do it. It creates, some concerns about validity and trust of us saying we're going to do something and then pulling it back. We want to be more responsive to the community at large, where we know that early on, these orders, we would find them out. I'm talking about the state. The orders would come out, and then it would say it would take effect today at 5:01 or something like that, giving people very little time to pivot. And I think that impacted a lot of us locally, to where we had also kind of follow that same process of issuing an order and giving everyone a very short amount of time to, one, be informed about it, but two, comply with it. So we want to make sure we're giving adequate time. As I stated prior, that the health department in the city of Milwaukee, we review our data and we provide an update through our immediate alerts every Friday. So we're going to give you an update on where we're at, is what we're seeing statistically significant or not. Just because you see something doesn't mean it's statistically significant. So that's what we use to weight how we move ahead. Also, we still use those two indicators of PPE and access to healthcare that the county uses. Those are updated on Mondays and Thursdays, so we follow that same schedule. And then the contact tracing, the health department is in a much better position than it was early on, because now we have a big group of contact tracers, and we're able to handle what's coming in. So we've been able to build that out. So I just wanted to acknowledge the team under Dr. Heather Parody, being able to build that team out. And then we're also preparing to bring even more staff on board, because there's various elements of this process where we're trying to box the disease in. So we have the case investigations, the contact tracing, and the monitoring aspects, which are all very important. But we also have to just put the alert out to the public for cooperation, and asking for cooperation when we reach out. I know the governor's office released something about this is what happens when a health department person reaches out to you, to provide some context and try to eliminate some fear about getting that call from the health department. But if there's no cooperation, or there's avoidance of working with public health, there is a legal issue there, and we haven't really pursued that yet, but it's something we are discussing with legal, that you have to cooperate with the health department, because we're trying to prevent the spread, and we need the public's health and the community's health to be able to do that.
Thank you. And, oh,
Dr.
yes.
Weston, is there anything you want to add?
Sure. So I think I would say that, well, I would preface by saying I'm not a policymaker, but my thoughts on it are, we've learned a lot about COVID since the beginning, but I think no matter how much of an expert you find anywhere in the country, anywhere in the world, nobody's going to predict what happens next week or next month or next season. And so my thought on the phasing, I think it's good. I think it provides clarity. I don't think we're chiseling these phases in stone. I think we need to react to what's coming and respond to what the community needs. And so I think it's a continued evaluation, a continued assessment to make sure we're keeping everybody as safe as possible.
This is John. I might just add that, you know, like all politics is local, all epidemics are local. And there's not a day that goes by that I don't access the state and the city public health department to try and understand what we're dealing with. And the city and the state are making decisions with incomplete information. And if we had more people getting tested, we would have a lot better information. I'm very appreciative of the state and the county's efforts and the city's efforts to guide people like me that are trying to manage on the receiving end what's happening. So I would really, if we had more testing data available for them to make decisions on, they could continue to refine what I already believe is an excellent model for managing this.
Thank you all for the different perspectives, very valuable. Allison Durr's second part of her question is for Mayor Barrett. She asks, have you seen the MKE Cares mask legislation? And if so, do you support it?
I have not seen the language itself, but we have been working with Alderwoman Dimitrievich, and I'm very optimistic that we'll be able to come to a meeting of the mind. So I have not seen her legislation. We know what it is, but we've been working with, obviously, the health department, the city attorney's office, and it'll be modeled on in other cities. It's already in place. So we feel very comfortable at this stage. Again, I say that without having seen the actual wording myself.
And I would like to know, so Mayor Barrett's office, as well as himself, has been actively involved in helping to look at what's happening in other parts of the country. Where do we stand versus others? And even getting down to the point of what is going to have the most weight. And we could have included the mask wearing in phase 4 order, but looking at other situations and determining that that was shaky. So we didn't want to compromise that. So, you know, that should be noted, that the thoughtfulness and care that's going into this is very important for its sustainability moving forward.
All right, excellent, thank you. Rebecca Clough with TMJ4 would like to ask her question of our guests.
Mayor Barrett, it's regarding the mask issue. So you are looking to pass this through the Common Council. If it doesn't pass, or there is not support for a mask policy through the Common Council, is there a way to implement that? Because it sounds like what you're saying is there needs to be some sort of mask policy implemented in Milwaukee moving forward.
I am optimistic that we will be able to reach agreement with the Common Council to have a policy. So I haven't even considered what would happen if they don't, because I'm so hopeful that we'll be able to do it. And again, unfortunately, and I really mean this, unfortunately, a lot of this is driven by the fact that you're seeing these dramatic increases in California, Texas, Arizona, Florida, and other southern states, that all the optimism that everyone had that we had turned the corner now is really under question. And when you see Dr. Fauci, or when you listen to Dr. Fauci saying that we may go from 40,000 cases a day to 100,000 cases a day, and a lot of that is attributable to the fact that people are not keeping their social distance, that leads me to conclude, look, we have to take steps to make sure that we are doing everything we can to slow the spread of the disease. We know people don't want to be inside, so we have to take steps knowing that they are going to be out in public. What can we do and what can they do, not only for their own health, but for the health of others?
Thank you. And our final question is from Ashley Sears with Fox 6, and it's for Commissioner Kowalik. She asks, will you explain how the health department will be making sure restaurants and businesses are following the guidelines? And what sort of punishment might they get if they are not following the rules?
So that's a great question. So of course, we through our Consumer Environmental Health Division are focused on customer service and having a solid relationship with operators. We know that many are well-meaning and they want to do the right thing. We also know that some may be overwhelmed as far as staffing and who's going to be the bouncer, if you will, for people over exceeding whatever the capacity is or not wearing masks and things like that. But those are all elements of operating at this point in time. We have to realize that this is our new normal and we have to do things differently. We just can't go back to how we were, because you're seeing other places that did have done that, and you're seeing that play out now with these massive increases of cases in those areas. So it's inevitable. Something has to change. So the enforcement piece we are taking seriously at this point. So our consumer environmental health staff, they are assigned to areas across the city of Milwaukee, and they will be monitoring their zones or their areas. Also receiving any complaints or evidence or footage of violations and addressing those as such. Again, the first point is having a conversation with the operator. The next point, if there's repeated infractions, is getting to some monetary punishments as far as citations and things like that. And then of course, these places are licensed and the city is the one that licenses them. So there's a possibility that a business could be in jeopardy of losing their license if they're not compliant. So it's just like with foodborne outbreaks or anything else where has to be regular communication between the health department's food inspectors and the operators. And we have been working with a variety of business groups and associations to work together, because we are in this together. We don't want this to be us versus them type of thing. But we know, there are some that, no one's enforcing it, so they're going to push the envelope, and others that are like, look, we're not even opening up for dining in at this point because we don't feel it's safe, and that's their prerogative. But we want to continue to support if businesses are going to take advantage of the opportunity to still stay under that limit, the lesser of the three, the 250, the 50% of building occupancy, or the 1 per 30 square feet. We also know too that we have our safe pilot program that we're looking at right now, where we are accepting applications to review safety plans for businesses to be able to open up at 100%. We know there's been talk of the Active Streets proposal of being able to expand some capacity to have just only outdoor dining versus indoor dining. We definitely feel that that's a better approach at this point in time. But, whatever adjustments have to be made, we want to work together and not against one another.
And Sharon actually has one final question for Dr. Fangman. She asks, what are the long-term effects of COVID-19? Do we know yet?
Great question. And the answer is clearly we don't know yet. We don't know the full population of people that are infected. The CDC has estimated that there may be up to 10 times as many people infected as are being diagnosed. So we don't know the full population. We do know that there is a subset of patients who can have a very protracted illness and recovery. And early concerns are being raised about long-term consequences of that in terms of especially lung function. But much more work being done on that, again, to emphasize very dynamic. COVID-19 is obviously not just a respiratory tract infection, it's a multi-system infection that can produce both acute and we think long-term sequelae. So more to come on that, but yet another reason to stay away from, to the best extent you can, COVID-19, and to get tested so you can engage with a health professional as soon as you were infected.
Well, thank you. Those are all the questions I'm seeing for today. Thank you to all of our health experts. Your varied expertise was really valuable and appreciated today. Thank you, everyone, for joining, and we'll be back on Thursday at 2 p.m. Have a good rest of your day.
Thanks, Catherine.
Thank
Thanks.
you.
Bye.
Thank you.